Hi everyone, we're hoping to use some technology here, so undoubtedly it won't go to plan, but fingers crossed, we've ran through it. So what Katie and I are doing in this session is to look at the training that early career researchers may require, and to get your opinions on what we could do as co-leads of FAN to try and implement training and inform the blueprints that we are hoping to write to demonstrate what training requirements are required for early career researchers, especially in the focus of antimicrobial resistance. So just to let you all know who the co-leads of FAN are, we've got Linda, of course. I'm sure everybody knows who Linda is. And she has put on this amazing conference today with Prachi, who've done all the organising, and we've just slotted in and done what we're told. So again, we're just hoping to use this as a platform to get your opinions and what sort of training needs that we could help implement. Because we all know through all our different institutions there are platforms to help with training of early career researchers, but what we hope to do with FAN is to look at what sort of training could be implemented to help with the focus of antimicrobial resistance. Just to introduce some of the other co-leads, we've got Alberto, who's in the audience, and Nikhil Bala, which I'm not sure has arrived yet, but he should be on his way. I'm Janice Spencer. I'm a microbiologist, and I currently work at Glasgow Caledonian University.
Yeah, so I'm Katie Lawther. I'm a postdoc here at Queen's. I work with mainly the Hughes Lab, and I overlap with like the Creevy Lab and a couple of others, but I'll be given like the next half of the asking about the blueprint.
Okay, so the Workstrands that are involved through the FAM network is looking at mentorship and training, and Workstrand has implemented that, so I'm sure you've all been in touch if you want to take part in that stream. I think mentors and mentees have been assigned, is that right, Mojin? Yeah, so we're on course for that one. But the strands that we really want to give a focus on now that we're actually a year into the funding is to look at the training schemes and the blueprint that we need to produce by the end of our funding. Some of the other strands that are involved in this is the AMR solutions, and also looking at arranging member events and engagement events, which again, this counts as one of our engagement events because it's so nice to see lots of people coming together. And that's the other 7 networks that were actually funded at the same time, and lots of these have sort of methodology expertise and can provide specific training in that, and we try and circulate any sort of training that has come from those networks through FAN to let you know that it's available. So initially I'll just talk about training, and then I'm going to hand it over to Katie. But the training schemes, these are some of the expertise that we've got that we thought we could introduce into the training scheme avenue. And this is just going from the expertise that built up the leads for the actual network. But we need to know, like if there's other sort of influences that we could implement into our training schemes. And ultimately, the training schemes will have a direct correlation with the blueprint, but the blueprint is really to focus on the needs and what ECRs can actually give to the field of antimicrobial resistance.
It's just the next one, isn't it? Yeah, so I'm leading the AMR blueprint, which is hopefully going to bring together a kind of smaller group of ACRs, but then engage with the wider research field to identify research gaps and challenges and solutions, but specific to ECR voices. So how can the ECRs really influence future decisions, because we're obviously going to be the next workforce, the next leaders, so trying to get our unique perspectives in things that maybe we're normally underrepresented on. And then hopefully engage with stakeholders to try and get our voices heard and how we can improve the research experience for ECRs. really hopefully the outcome of this is trying to put together some sort of white paper or a publication to then disseminate it wider. We have the working title of Charting the Future, Insights from UK Early Career Researchers on AMR Strategies and Research Priorities, but that can change based on what we kind of find out. It's going to be very community-led. If you want to sign up for my Workstrand, we're still very much recruiting, so please, I think this QR code should work, but if not, just talk to me during the next coffee break or tomorrow. So we're going to start the polling, I think, now. Yeah. So back to Janice as the tech.
Fingers crossed, wish was luck. Okay, so if you've got your phone available, the QR code should work, and it should take you straight to the polling software. If the QR code's not working, if you input the web address, that's ttpoll.eu. Are we in? Is it working? Oh, I don't want to do this too soon. See, in the session ID, if you put in the fan blueprint, it doesn't matter if it's capitals. If you just put in the wording, it should take us to the first question when I click this button. Are we all right? Yeah. It does work. It works when I'm on campus, but I've never done it elsewhere, so this is exciting. Okay, so hopefully you should see the first question. You might need glasses because it's dead small. So just a nice little icebreaker, and it would help us when we come to collect the data to see who's actually been given over an opinion. See many people fiddling with their phones, because usually when I've got my screen here I can see how many people have voted, but if I click this button it's going to bring us over to our results. So there we are. Okay, so that's excellent. So we are attracting the people that we're hoping to talk to, which is the early career researchers. So we've got a decent spread, but we've got the majority of postgraduate students, so hopefully MSc, PhD, and lots of postdocs. And of course, the early career researchers stretch right into the lecturer's stage. Okay, excellent. Yeah. So the next question is focusing on the training aspect, is which type of training would you most be interested in? These are things that these are some of the ideas that have been discussed in our group, but we've actually circulated, well, not circulated as yet, we've got some paper there, or if you've got any other ideas, scribble it down on a bit of paper and hand it to us, and I'll try and collate the results and circulate that to everyone.
I guess if you're not an ACR, just imagine you were an ACR. What do you think you would benefit if you were to go back and be kind of early career?
Okay, methodologies. We thought that would probably be one of the most popular choices. Methodologies is really, really important, because if you can't do the experiments to confirm and understand the technologies, then you can't really progress in the field of AMR. But again, there's other networks that are involved with developing these methodologies. So again, Linda and Prachi have got a really close relationship with the leads of all the other networks, so we will transfer any training opportunities and publicise them as widely as we can. Okay. It's quite interesting seeing the spread. Networking. I mean, these are definitely sort of training schemes that we could easily implement. So the next question asks, how would you prefer training delivered through FAN? I mean, there's nothing beats face-to-face. I mean, being in the same room at the same time and discussing is really useful, but that's logistically quite difficult. So again, online, as we know, the world is so much smaller with new technologies. So again, we can talk in person across vast distances. Absolutely, in-person events, so we can definitely try and get these things organised. Interactive presentations are really useful, and these are things that we'll take on board, and that will really help us understand the needs and try and implement resources to further training.
So I kind of want to use this survey as like a little pilot scheme to try and then build the themes that are going to be in the blueprint. So the first question is whether you strongly agree or disagree. Do you feel ECRs have adequate voices and representation in important things such as AMR policy discussions and funding decisions? So do you think our voices are heard or represented in some of these things? Okay. So, yeah. And I guess it was kind of a leading question, right? I kind of put it there because I probably strongly disagree, but it's maybe good to see that this is the type of thing that we need to be including in our blueprint, and now we can include some of this data to back up such claims. So yeah. So what is the main barrier you currently face as an ECR? I've given some examples here, such as funding access, career progression pathways. Obviously, I've not thought of everything here, so you can vote for other, and we have a later on discussion board that allows more input, but if you feel like some of these ones I've given are your main barriers, just pick one of those. So I'll give it. Okay, I think everybody looked. Huh?
I know, it's all that paper.
Yeah. Okay. So more of a split, I guess, but a lot of people voted for funding access, which I think is one of the most confusing things for ECRs, is how to get on grants or how to approach people to be on grants, or what grants are even available, I think is really confusing. Or if you're kind of being funded by, say you're doing your PhD, like you need extra money for your PhD, right? Lots of PhD funding is not enough to cover, especially if you're wet lab based. So how can you gain some access to maybe additional funds? And then we've got career progression pathway. Yeah, I definitely feel strongly about that one. I think it's getting harder to move from kind of postdoc to getting some more of these permanent positions. And then training skills and gaps, which, yeah, hopefully Janice's strand will address some of these things and help. So I've given some opportunities here. Which one do you think maybe would accelerate your ECR research the most? So what could we give back to you guys? So things like dedicated ECR only grants, or maybe more open access to data sets that some of these other universities might have, or things like research exchanges. And again, there's another option if there's something missing. Okay, so yeah, back to the importance of funding, I guess. Nearly over half the audience has... Oh, I don't know, can we go back? If I go, I'll try. Sure. I can, maybe if I, did you vote?
No, we didn't.
Okay. So I'll give a bit more time on the next one then. So yeah, again, grant is coming out, and then some of these cross-sector collaborations. So I think that's really something we could hopefully help as an ECR network, whether it's connecting to some of the other networks that were funded, or just like the mentor scheme hopefully will really help build some different relationships. And again, these in-person events, I hope everyone's had a chance to like network and meet people who they don't know. I think everyone's here because we believe that ECRs will have such an impact. So I would say don't be afraid to maybe approach some of the more senior people in the room. They're all here to engage with us ECRs. And then, whereas again, strongly agree to disagree, career pathways in AMR research are clearly defined and achievable to me. So do you agree with that statement or disagree? Okay, hopefully that was long enough. So actually a bit more mixed than what I thought that was, I suppose, going to be, but a lot of somewhat disagrees, strongly disagrees. Some people kind of agreeing. I guess whenever I was kind of writing this question, I was thinking it could be very dependent on what university you come, right? Some unis deliver a lot of career support and help, some don't so much, so that's interesting to see like such a spread. And maybe it depends on what career level you're at. And then what support or resources? So if we could give you kind of one thing as a network or help you with one thing that would really promote your research or get it to the next stage, what would that be? We're requesting short sentences if possible. If you have more to say, again, we have paper, or you can come talk to one of us if we want to hear your bright ideas that we can champion in our white paper.
Sometimes if you write too much, it sort of masks all the other information that other people have put in, so it's quite difficult to see in the word wall, but we'll be able to decipher it once we see the results. It's been interesting to see some of the responses. I mean, there's definitely things that we can build on, definitely within the network, even showcasing some of our institution training schemes as well, and getting people to come and talk. So would you prefer to have a monthly support session, maybe for an hour or two every month, where you can check in, maybe have some presentations and information? Would that work for most people? So on the mic. Sorry, I thought it was loud enough. Would you be open to having a support session maybe once a month for maybe an hour or 2 hours, where we could lead in with some presentations and then have a discussion group? Is that something that you would like to be involved in? Yeah?
Some people are nodding.
Yeah, that's good. Yeah.
So hopefully everyone's had a chance to answer the slightly longer question, but we'll look at the word wall. So yeah, right in the middle is funding. I think funding's a couple of times in trainings. Short-term blue sky funding, yeah, that's a really good idea, how to kind of access some of these things that exist. How to get invited onto grants. Instrument access is a really interesting one. I think kind of that's something that your lab might not have it, your institute might not have it, but maybe somebody nearby does. So that's really, really a good suggestion that we can kind of hopefully lead to more collaborations. Career advice, something like funding I see a lot, and interesting one is ECRs, helping lower ECRs. So in our mentor system, you like I'm a mentor, so I'm a postdoc, but I'm mentoring some PhD students, so that's definitely a really good suggestion, because I think even like PhDs have a lot to offer, say a master's student, and etc. So I think that's a really good suggestion as well. And then another slightly longer question, but one specific recommendation that I should cover in the blueprint group. So I guess this is quite similar to the previous one, but I'm really asking, so I know we want more access to funding, but like what should we actually recommend? So when we go to some of these councils or committees, like what are we saying that we actually want them to do for us that they currently don't do, I guess? Like what am I hopefully championing, or we as a fan network saying this is what we want? This is probably quite a hard question.
That's the last question, isn't it?
I think so, yeah.
And this is the last question, and then we'd just like to open the floor and just listen to your opinions, if you've got anything that could help us develop both the training and the blueprint group.
Yeah. 5 more seconds. And then...
I know she'll get a countdown.
Yeah. Okay. So look at our word wall again. Enable a matchmaking process. Better data access. Yep, DPP's funding again. Make AI work for AMR research. So that's definitely something we've discussed quite a lot as our co-leads of how to kind of make our training or whatever it is kind of really proactive or looking towards the future. And obviously AI is something that we're, whether we want to or not work in it, we kind of all are all ending up there. So that's definitely a topic we'll try to cover. And in the blueprint, I think we've already kind of been discussing how we can introduce AI specifically for AMR and what it's going to look like in the future, but also kind of some of the maybe smoke and mirrors that are associated with the AMR field as a whole and try to debunk some of these misconceptions. And then clear way to find opportunities and jobs. I think that'll be something that's really unique to our network because we're specifically for ACRs. That's something we can hopefully really help and deliver you guys. I think this is the last question, and I guess it's just the final resource. So specifically to your research, if it was a resource, and I'm trying to be more specific here, so not just grant money, but like actually something specifically to your own research. So that can be really personal to yourselves. That we can try and consider. This is really to capture, like, we could probably guess from the abstracts what kind of research you work in, and kind of like there was a lot of phage and different things, but this is really, we want to hear like your own wish list, if you will. Because there might be common things between you and someone at the back might want the exact same thing for your research, and we can start to build up these themes and pair you guys together. Just a couple more seconds on that one. It was a slightly longer question. Okay, so submit your answer now if you haven't.
Last chance.
Okay. So right in the middle there is bioinformatics training. Yeah, I think that's a common theme in my own lab even. They ask a lot for bioinformatics training. And these are the type of things we'll start to correlate if there's, somebody said more events like this, so thank you, that's a big positive to us. And then we will start to collate some of these, like a biobank collaboration is a really good suggestion. I'm sure there's multiple people would benefit from that. Computational training is another one that's really useful info for Janice as well to know that type of thing. So, yeah, so thank you everybody. Again, if you have more thoughts or you feel really strongly about some of these kind of like future visions for AMR network, please let us know. We have paper, but we also would just like to open the floor now if you have any questions, suggestions, or things that you'd like to kind of add to what we should be doing. No? Linda?
In case the ECRs don't know, usually in these meetings we have Amazon vouchers for people who speak and ask questions. So you might start thinking of a question. It just can be, what is your name? You know, that kind of question. I'm wondering, and some of those, I don't know if we can maybe pull that poll back, or if anything has joggled your mind whenever we were seeing this. I'm actually thinking, why didn't anybody choose impact? Isn't that something that ECRs want for their research whenever we were on that slide? So I think this 5 to 10 minutes that we've got left is really a time for us to have a discussion around what did we think about that poll? Is there something that jumped out at you or that we didn't consider? This one especially, I'm looking at it going, huh? Nobody went for impact, but maybe we don't understand. Yes, you want to tell us, thank you.
I feel like maybe with impact, it's because the other things come before impact. You have to have your methodologies to be able to do the research, then to be able to make an impact with the output. And I think, I'd imagine it's not that it's not important, but it's just that it comes after the other things.
Thank you. When I was thinking about it, I thought, shouldn't we think about what impact we could make before the research? Thank you. Yes.
Okay, first of all, I'm sorry because I didn't select impact. I wanted to select impact. I don't really fully agree with what she said. I understand. I don't remember the name of the scientist. I understand your topic, but I partially agree. For me, impact is really important, and I always try to make the students understand impact comes first. Once I have the impact, it means I have the right challenge question, the right scientific question I want to answer. And from that, from understanding how to answer the impact on the economy, society, and so on, I find the methodology. So maybe it should be done the other way around. Of course, the young generation has to learn methodology, has to learn how to write, and so on, networking. But the first thing I ask my students, what do you want to do in the lab? What is your scientific question? Why it's important for you? And after we clarify this, we understand what is the method, the people we need to have on board to help to achieve that impact, and how to write a grant and convince the people our impact is important. So I'm the opposite of you, I'm sorry.
I guess my follow-up to that would be, I think impact's quite hard to measure, or what's impactful to someone in one field is so different to somebody else. So maybe that's why people didn't pick impact. Like, is impact something that would affect everybody in the audience, or is impact something that would change just one person's entire research? Like, what is actually impact, I think, is something that I kind of struggle sometimes with research. Like, is your niche small but it would be impactful there, or you know, is your grant you're writing maybe more blue sky? So it's really hard to translate blue sky to something that's societal impact, because maybe it doesn't, but it would have, if it worked, would impact your research and other people's research quite a lot. So maybe that's where we're kind of struggling with impact, is sometimes how do we measure that? And not everybody's research is as easily translatable to human health, or you know, methane, all of those things that are quite easy to sell almost in a way of impactfulness. Some people's maybe aren't. So maybe that's where we're kind of getting stuck on impact, would be my thoughts. There's a question right at the back.
Hi. I think like the last slide made me think about like so many people kind of sort of put in something to do with like, oh, they would like bioinformatics training, they would like data analysis training, and I think like it was kind of mentioned in some of the talks, and I know like my research is purely computational, and one of the things we always caveat it with is obviously you'll need to do, you know, like wet lab experiments to be able to, you know, actually delve into what's really going on here. We can only predict these things, et cetera, but it doesn't, I like suppose people maybe who are a wet lab based, they would like to get more bioinformatics training. Like I suppose have like trained for 4 years to be a bioinformatician, and I wouldn't have a baldy on how to start anything in the lab. So I suppose like if we wanted to stop saying, oh, but in an ideal world, like you'll be able to test this in the lab, like where do we start being like, you know, where do you go to be like, well, I want this tested in the lab, like where do I go to? Like who do I contact to do this particular piece of research? Like to make that a bit, like I suppose maybe like an avenue to start those conversations about something. Like I would be interested in getting this tested in the lab, or maybe a postdoc to actually get that lab experience, but like where do you kind of start that process?
Yeah, that's like a really good point, is that I think it's a lot of emphasis on the past kind of like 5 years, maybe longer, is trying to upskill wet lab to be able to do their own computational stuff. But yeah, that like relationship goes two ways. Like you have, like I think Lucy's AMR work, and Chris kind of hinted at it, that you would like to do some knockout stuff. How do you make that collaboration with someone who's maybe already doing it and has that really large wet lab expertise that you could avail of?
Yeah, can I just add something quickly in here about actually the training needs there? I don't know how many of you came along to the sandpit events that we ran for the development of the Phase 2 UKRI grants. And I think they worked really, really well because it got people talking. And it's just me overthinking this when you're saying that you need training in that side and you need training in that side. Actually getting people together is probably more important. And I think that the sandpit events could be reintroduced to actually get people training and the needs and people talking. So I think that's something that's really useful that's come out of this that we can definitely implement. So.
Can I just follow on from what that chap over there was saying? That, yeah, I kind of wrote the same in as my comment. A platform for you to be able to quickly make links with collaborators, because I could just think of 2 examples where I've got samples already and I've got the funding to run the samples, but I need someone to help me do that. Or further down the line, I've had samples sequenced, but the comp sci guys I'm working with at my institute don't know how to identify ARGs, whereas that would probably be very simple for a bioinformatician to do. So I just want somewhere to go and quickly say, I have this, or I need this, and vice versa. People might say, I want samples for this. So I'd say, great, I've got them ready to go.
So introducing like a kind of monthly drop-in thing and just make sure it's circulated between our members to just have an open discussion about the needs and just introducing people, because the sandpits worked really well.
Yeah.
So how many people are actually members of Futures AMR Network in the room? Okay, so if you're not, please join up. If you are, some of you may not be using the website well, because on our website, you should be able to see everyone who's a member and who their expertise, what their expertise is, okay? Which means you can access them whenever. All of them have put their information there so that you can access them. And if you ever have something that you really, really, really need and you cannot find someone on the website, Prachi will answer your email a lot and just say, I'm looking for somebody here, can you help me? So I think that website is really, we've set it in such a way that everyone can have a profile and you can connect with people. We'll try now that we're 1 year into it, we're trying to give people opportunity to go and put their names on and so on. But we'll try now that we're 1 year into it to try and use more of the member-facing part of the website to allow people to connect. I get your point about bioinformatics, and I think that what's happening is you are doing bioinformatics, so you're from an all bioinformatics team, and some people are doing wet lab, and they're from an all wet lab team. They don't have a bioinformatician to go to, or they want to learn it themselves, but they don't have the actual time to actually go and do it. In the space of the PhD, you've got 3 years. If you think about all the lab experiments that you're doing, when do you actually have then time to go and do bioinformatics? Because it's not something you learn, drop it for 5 weeks and then go back to. You need to keep in momentum, right? So maybe that's where we need to have a conversation.
Okay, yeah. Thank you guys all so much for all of your feedback. And you'll probably get some emails. And if you, again, want to join either of our work strands, if you feel really passionate about the blueprint or training, please let one of us know. Thank you.